The Minister for Health, Dr. Ruth Aceng, together with implementing partners, visited Entebbe and Mulago isolation centers in support supervision of isolation facilities ahead of the ongoing Ebola outbreak.
West Africa.
Dr. Aceng also disclosed that there are 2 Ebola vaccines that are on trial and being reviewed by National Council of Science.
That are ready for trial in the country. We have the Oxford vaccine from the United Kingdom and the Sabine vaccine from the United States of America. Right now our protocols are ready. They have been reviewed by the National Council of Science, and the teams that are going to handle the vaccine, we call it a research because we also want information, are all ready and set, and all that is required to have the vaccines in terms of cold chain is ready.
The minister also noted that the current lockdown in Ebola-affected districts is paying off.
And I want to believe that up to now, you have not heard us talking about any new case coming from those areas into Kampala or Kampala metropolitan area.
So very important. I want to recognize and commend all the healthcare workers and certainly the village health teams who've been going door to door to do contact tracing. That's the first line of defense. And this is knowing who has been exposed and who may possibly be infected so that they can get treatment sooner rather than later. I think the sooner people get into care, if they are infected, the better the outcomes.
She also stated that the ministry has mobilized enough funds to handle Ebola response in the country.
The government of Uganda put in $6 million US. You have been hearing from other partners what they have put in, but what is already invested on the ground as well.
As of now, we have been able to secure $5 million, and as of now we are moving by borrowing money from our headquarters with the anticipation that our development partners will come in and help us in repaying the loan.
In a move to centralize laboratory services for testing Ebola, Dr. Aceng said there are mobile laboratories on standby and ready for deployment. The minister also revealed that they are recruiting over 1,490 additional staff of different categories to handle Ebola response in the country.
One at Ajumani, one at Elegu, ready for deployment. They are all PCR laboratories. CDC has brought in 2 mobile laboratories, and WHO is ready to bring in another mobile laboratory.
Zahara Abigaba, UBC News.